Hi, this is Dr. Hurt, and what I want to do is I want to go through our joint mobility. So we'll start with the cervical spine. And the first thing that we're going to start with is flexion and extension. And then do from the side view, we also want to do chin out and retract. Okay, and then we're doing rotation. Turn as far as we can. We're doing both sides. If you go to one side and there's discomfort, pain, we don't push through that. And really with any of the joint mobility. Okay? And then we're going side to side. And you want to do these, 5 to 8 times each side. For video purposes, we'll do them 5 to 8 times. Then we move into shoulders. So what we're going to do, we start with small circles down below. Okay, we go one way, then we do counterclockwise. Okay, and we're doing them up here, counterclockwise. Then we get into our shoulder rolls, circles, sorry. Okay, make them bigger. Okay, and then we go the opposite way. And then bigger. Now we actually go into rolling our shoulders to bring the shoulders up, back, and down. Up, back, and down. Okay, and then we move into our elbow joints. So what we're doing here, making circles, but what you want to do is, you notice here, you lock the joint out. Okay, and then once again, now we do the other way. Okay, and then we get into our wrists, bending forward, back, forward, back, going side to side, especially people spending time on a mouse. Okay, and then we do our fingers. Then we move into the trunk. So you're going to bring your hands by our belly button and we're going to turn. As the majority of the turning and rotation actually happens in the thoracic part of the spine versus the lumbar spine. Okay, and then do our side bends. Okay, and then some work for our thoracic spine. I'm going to give you both views. I want you to pretend like you're hugging a barrel. And what we're doing here is you're pushing your chest out, moving the thoracic spine segment by segment, and extending, pushing it back out. Okay, and how it looks from the front. So this area really takes a lot of abuse from a computer, anything that puts you in that anterior head syndrome. Okay, then we get into our hips. We go side to side. Okay, and we do what we call anterior and posterior pelvic tilts. So imagine that there's a rod right here in the front of your hips and your pelvis. It has dials, and what you want to be able to do is, what you're going to do is you're going to bring your hips out and then bring the stomach in and then flatten the spine. Okay, and then from the front. Okay. Now we move into our hips. So ideally, when you're doing the hips, what you want to do is we're going to go forward and we're also going to do side. So you're going to want to have a place where you can maybe grab a stick or or something that you have support. So called pendulums, so we're going forward. Okay, and then we're doing side to side. Okay, the other leg, side to side. Okay, and we work into knee. So same thing when we're doing the knee. We're gonna extend. Okay. And then we're doing the other knee. Once again, notice about 3 to 5 times. I'll try to get to 5. And then slight bend in the knees, make some circles. Okay. Then we move into some of the ankle work itself. Okay. So what I'm doing here, we start with up and down with the toes. We call it plantar flexion, dorsiflexion. So pointing the toe up and down. Then we're getting on the outside and inside. Outside and inside. Other foot inside. Okay. And then we're making some circles